Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today the topic of our lecture is the visual pathways. So whenever we are concerned with the defects of the visual fields, or it can be the visual acuity that is affected in a lot of patients, or it can be the ocular movements that are affected in a particular patient, one should know what is the normal visual pathway that is followed by a normal person. So knowing this normal visual pathways and differentiating the abnormalities that are detected in between this visual pathway is the main focus over here in this lecture. So first of all, in this very first section, we'll be defining the eye examination, because eyes are the windows towards the brain. So if there are any defects that are affecting the brain functionality, for example, it can be the strokes that are affecting the functionality of the brain or of the occipital region that is primarily dealing with the vision, that can affect the visual acuity of the person, or even it can be the visual field defects that are demonstrated in these people. So over here in this very first section, we'll be dealing how do you basically examine the eye of an individual to rule out the abnormalities or to detect the abnormalities in the normal visual pathway of that particular patient whom we're talking about. The procedures that will be discussed over here, what are the different kind of tests that we perform to evaluate the visual acuity in a particular individual, to evaluate the visual field effects, may it be the central field effects or it can be the peripheral field effects that can be administered or demonstrated in a particular patient. And then there can be the color blindness that can be demonstrated in these individuals, as well as in a lot of patients, the ocular motility tests are performed just to demonstrate the different abnormalities of the visual pathway. So we'll be defining a normal visual pathway, what are the temporal zones, what are the nasal visual field defects that can be demonstrated in a person who has some sort of an abnormality in his or her visual pathway. So that will be the first section of this lecture. In the second section, we'll be comprising the retinal quadrants. So usually we divide the visual fields into four major quadrants. That is basically the nasal quadrants, ranging from the upper and the lower nasal quadrants, and then we have the temporal quadrants, that is the upper and the lower temporal quadrants. And any field effects are basically defined depending upon in which quadrant this field effect lies. So that is basically the mainstay over here. How do we define these retinal quadrants? And then the monocular visual fields that will be defined over here and discussed over here. And then we'll move on to the blind spots. How are these blind spots formed? What is the basic main pathology behind the formation of these blind spots? Even in a normal person, these blind spots are present, and that is basically an indication towards the optic, towards where the optic nerve is basically entering the retina. That is basically forming this blind spot even in a normal person. So knowing this blind spot and knowing that it is a normal thing that is present in everyone, in even a person who doesn't have any pathology in his or her visual pathway, he or she may even have a blind spot, and that is basically not a visual field defect. So that is basically what we'll be discussing over here in the second section. And finally, in the third section, we'll be moving on to the binocular visual fields. So how does a person have this binocular vision, and how do you differentiate it from a monocular vision? That will be discussed over here, the demonstration and the cortical areas that are concerned with this binocular vision formation in a normal person, that will be discussed over here. Then we'll move on to the lesions of the visual pathways. So basically it depends upon the level of the lesion in the visual pathway. That is how it is going to affect the visual field in that particular person. And one should know these pathologies that will be discussed quite briefly through the methods or through the help of the diagrams in this section. Pupillary constriction pathway, it's another pathway through which the pupillary light reflexes are demonstrated, and that will be also discussed over here in this final section. So I hope you want to learn more about these visual pathways, so do watch the other sections to this lecture as well.